Morning, everyone. Let me begin by acknowledging the two ladies who are here with me. To my right is Dr. Allison Arwady, our Commissioner of Public Health, and to my left is Dr. Nancy Glick from Sinai Health System's Infectious Disease Division. We call this press conference today to discuss the very concerning increase that we are seeing in COVID-19 cases across Chicago. Make no mistake, we are in the second surge. And here's why we say this. Over the past 2 weeks, daily cases have expanded to an average of over 500 new cases every day, which is more than a 50% increase since the beginning of this month. This is the highest daily rate we've seen in Chicago since the tail end of the pandemic's first wave back in May, and is coinciding with a worrying increase in hospitalizations. Although our average number of positive tests is now over 500, we had almost 800 positive tests reported in a single day last week, marking the largest one-day jump since May 21st. These numbers are extremely troubling and are consistent with what we've been seeing across Illinois and really across the country and world, where COVID-19 cases in Illinois have risen by more than 70% over the past 2 weeks, and COVID-related deaths have jumped by nearly 30%. That's the Illinois figure. Meanwhile, many of the areas with the worst outbreaks in the country are occurring just north of us in Wisconsin. Folks, make no mistake, this is the second surge that Dr. Fauci and Dr. Arwady have been warning about since March. We are now in it. And the reason should not be any surprise to any of us. Let's take stock. COVID thrives in enclosed spaces. And as the weather cools and people spend more time indoors, the chances of outbreaks and new cases go up exponentially. We've been talking about these kinds of risks now since the very beginning of this pandemic's entry into Chicago. And this is exactly what we're seeing everywhere across the country and around the world. Here in Chicago, we must do something about this. You and I, individually, must do something about this right now. I understand that a lot of sacrifices have been made over these many months. And I also understand the fatigue factor that people have. But folks, given what we're seeing and the incredible escalation of the rates of cases every day, this is not a time where we can indulge in COVID fatigue. This is a time for us to be more diligent and more determined to fight this deadly disease. This is a critical inflection point and a time for us now to make some changes. And on this point, I want to be very, very clear. We have tried to be prudent in reopening our city and using the dimmer switch, not a light switch. And many people have done a terrific job in adhering to the public health guidance. I want to thank, in particular, individuals, healthcare workers, first responders, and our various businesses who are literally hanging on by a thread to make sure that they can be part of our future and not our past because the businesses have closed. But this is a time for each of us to dig down even deeper and be more diligent. And if we don't see a dramatic turnaround in our numbers and soon, then we will not hesitate to take the steps that are necessary to save our city, to save our residents, and even if that means going back to some of our phase 3 restrictions. The rising case numbers we're seeing here are happening across the board. The conversations that I've had with Dr. Arwady and her team is, what's the source? Is it specific? Is it targeted? What interventions can we do to push back on and mitigate against these surging cases? But the truth is, it's happening across the board, across every age and gender, across north, south, and west sides, among black, white, Asians, and brown residents. That's the troubling trend. We're seeing this uptick, and Dr. Arwady will go through some slides that really show this in a very graphic way. Every age group, every demographic, every area of the city is seeing a dramatic uptick in cases. And I'll say again, I know we're all tired. I know that being diligent in the fight against COVID takes a psychological toll, takes a physical toll, but we have to be diligent and push aside the COVID fatigue. When we let our guard down, if we pretend that COVID is not the deadly virus that it is, the result, with certainty, is sickness and death. And now, as we head into the fall and winter months, it is the worst possible time to let our guard down. The virus is real, it is deadly. Already this year, tragically, over 3,000 Chicagoans have lost their lives to COVID-19, and unfortunately, we see a daily uptick in those cases. Every single day, someone dies in Chicago from COVID-19. That has not stopped. And you need only talk to the families who've lost loved ones to this disease, or the individuals who have gotten on the other side of it, but have lingering physical and mental effects of this disease that they are struggling with long after they have tested negative. Stopping COVID-19 spreads starts with each one of us remembering precisely what is effective in the first place. And of course, it starts with face coverings. Folks, these work. This isn't a partisan issue. This is not up for debate. It works. It saves lives. And we've got to double down on wearing our mask. We've got to double down on maintaining social distance. I've heard some disturbing reports that in certain venues across the city, in some businesses, in some big spaces, in some houses of worship, that people are not taking it seriously. They are gathering in mass and endangering themselves, their loved ones, and our city. We also have to not forget that we've got to wash our hands regularly. We've got to take every precaution in our toolkit. We have the power to bend this curve back down in the right direction, but we and you and each of us has to be diligent. That means we as a city government are looking at every tool in our toolbox, including rolling back to phase 3 restrictions or other measures as needed. Now, let me be clear, I don't want to go there. Particularly for those who are in business, the small businesses who have already suffered through a very difficult year. This would be tragedy for many of them. But I've got to do what is right to protect us from this virus. So please join me in this fight. Each of you, everyone, double down, be more diligent in what you're doing to fight this disease. Let me give you a few more facts. 2/3 of those who got COVID-19 got it from someone that they know. We know that through case investigations and contact tracing. What this means is it probably came from your friends, your family, or a coworker. That means is if you spread it, chances are you'll be spreading it to someone you know. And let's not forget what we talked about months ago about what the risk levels are. If you're in a gathering of 10 randomly selected people in Chicago, there's a 14% chance that one person in that group is infected with COVID-19 right now. If you're in a group of 25, that risk factor jumps to 30%. And in a group of 50 or more, the chances go up 50% that somebody in that group is infected with COVID-19, and on from there. And the reason this exponential growth is the reason that this exponential growth is happening. It's because the more people gather, the more opportunity there is for COVID-19 to spread. That's why we need to keep our group levels and gatherings as small as possible. On top of sticking to the fundamentals of wearing a mask and social distancing, we also need to be vigilant on limiting the number of people we come into contact with on a daily basis. Now, I know this is easier said than done, particularly for essential workers who can't work from home, many of whom are Black and Latinx and have already been disproportionately impacted by this disease. But what we can control is our home environment, which is why we need to be limiting the number of people who are coming into our homes. Now, over the course of the summer and the fall, when we were feeling a little bit of comfort, what did we start doing? We started having dinner parties. We started inviting people over to sit in the backyard. We started having card games and family gatherings. The normal things that we do because we are social beings. We like being around other people, particularly our loved ones and our friends. But I'm here to tell you that that has to stop. And particularly as we are coming on Halloween, and then Thanksgiving, and then Christmas and Hanukkah and other holidays, we have to be diligent to keep down the number of people that we are allowing into our homes. And I want to speak to our young people as well. We have increasingly seen large gatherings of unmasked young people walking down our streets, whether bar hopping, traveling in large groups to someone's apartment. Folks, that has to stop. You are not immune to the effects and the ravages of COVID-19. We see that in the data. You are getting infected. Now, your symptoms may be less extreme, but when you get sick, you take that with you. You are infecting your friends and your family. You are not immune just because you're young, just because you're 18 to 29 or 30 to 39. This has to be an all-hands-on-deck moment for all of us. And I want to say this again. Our first line of defense against the spread of COVID-19 is through the actions that you and I take as individuals every day. Not just some days, but every day. When you leave your home, you must wear a face covering. Limit the size of your gatherings. Limit, if not eliminate, bringing other people outside of your bubble into your home setting. And Dr. Arwady will talk in a little more detail about what that means. Now, we have not seen the kind of challenges that our neighbor to the north in Wisconsin or Iowa or Indiana or even other parts of Illinois. Why? Because you have made a commitment to your health, the health of your family, the health of your city. Now is the time for us to re-engage in those things that we know that work. This is a warning sign. This is a call to action. This is the thing that we need to do as a community to protect ourselves, but also to protect each other. We don't want to see us have to go back to the kind of restrictive measures that were commonplace in March and April and May. But if we need to, we will. I won't hesitate. This is about saving lives. It's about saving your life and the life of somebody you love and you care about, and about the life of your neighbor and the life of our city. We can't get through this without being in this together. We prolong the misery that we're seeing spiraling up, that it means more devastation across the board, more deaths, more sickness, more businesses and livelihoods dramatically and maybe irrevocably impacted. Now is a time for each of us to step up. And I call upon our fellow Chicagoans to be with us, everyone in this fight. This is our moment to make the difference in what our future is going to look like. Thank you, and at this time, I invite Dr. Arwady to come and say a few words. Doctor.
Thank you, Mayor Lightfoot. I'd like to echo what the mayor just said by showing you some data. As always, we at the Chicago Department of Public Health have continued to follow this data every day. It is available to you as well, chicago.gov/coronavirus. I encourage you to watch right along with us. We are sounding this alarm because the increase is real. As our first warning sign, Chicago cases are now increasing sharply with a rate of increase similar to what we saw early in the first wave. If you look at this graph, and again, we'll post this on the website, I don't want you to pay attention to the numbers as much as I want you to pay attention to the way that is rising very steeply. And do you see how the way it is rising steeply right now, just over the last week, is approximately the same rate that it was rising way back in March and April. Epidemiologists and public health scientists worry the most about how quickly things are changing. So yes, I'm very concerned that we are over 500 cases now. We're at an average of 508 cases today. But I expect this to keep growing. And although downstate, we've seen many regions that have exceeded the peak of what was seen in the spring, we're not there yet. There's no reason to think we may not get there if we're not able to bend that curve quickly. I fully expect this number to pass 600, potentially even within the week, and maybe to keep growing from there. You'll see our rate for cases went up 45% just in the last week. And as you heard the mayor say, just over 50% since the beginning of the month. Secondly, another warning sign. Chicago COVID-19 cases have dramatically increased across all race ethnicity groups. I sometimes hear people saying, COVID's just a problem in this part of the city, or with this particular race or ethnic group, or with someone who has this particular risk factor. But look at this graph. Blue represents Latinx Chicagoans. Yellow are people who report other race ethnicity but non-Latinx. Red are white non-Latinx, purple are black non-Latinx, and green are Asian non-Latinx Chicagoans. And in every one of those groups, we're seeing steep increases. That's a sign that the outbreak is widespread. It also makes it much harder to put a targeted intervention to control it. Another warning sign. Chicago cases have dramatically increased across all age groups, including among older Chicagoans. One of the things that I hear a lot are people saying, it's just the young people getting COVID. We really shouldn't worry about it. We can protect our older folks. And it is true, as has been all along throughout this summer, that the red line there on the top are our 18 to 29-year-olds who continue to disproportionately see COVID affecting them. But it is also true that across the age groups going all the way down, including people who are over 80 years old in Chicago, we are seeing case rates rise. And that is because even if it is younger people who are out and about more, and even if it is younger people who perhaps are feeling less concerned about COVID, they also spread it. Another warning sign. Testing continues to increase in Chicago, yes, but the number of tests needed to identify one case is decreasing. And let me explain a little bit what I mean by this. There are a lot of people who want to say it's just an increase in testing that is driving this increase in cases. And it is true that we are breaking records for the amount of testing that we are doing in Chicago. We're up to an average of 10,823 tests per day, and that's up. But it is not up the 40 to 50% that we're seeing cases rise. And the idea of a number needed to test is a way of understanding how many tests are you doing in a city to find a single case of COVID. Ideally, as your tests are going up, you're needing to test more and more people to find a single case. So what we see here, just in the last week, while the number of tests continue to go up, but the number that we needed to test to find one case was going down, we know that it's not all testing, and in fact, there is more COVID. We're down to needing to test just 19 people in Chicago to find one positive test result. We want that up over 20, over 25, over 30, even over 50 if we could get there, and it's going the wrong way. Another warning sign, our test positivity, just again in the last week, has once again gotten over that 5% mark. We worked really hard all summer. It was the main thing holding us back, that we could not get the test positivity under 5%. And now, in just a week, we've seen that progress reverse itself. We're now at a 5.4% positivity citywide, and some zip codes are much higher. I will highlight that only the 2 zip codes in the lightest blue are at or under 5%. All of the zip codes in moderate blue, medium blue, darker blue are over a 5% positivity. And in the very darkest blue, they're as high as a 19% positivity. We are seeing increases in every part of the city, and in no part of the city am I satisfied with what the percent positivity is. It is true also that 5.4% positivity is better than any other region in the state of Illinois, but it is not good, it is not in control, and we cannot rest comfortably in that number. And finally, COVID hospitalizations. We count, and if you go to the website, you'll see there's a number of ways that we follow COVID hospitalizations. We count the number of Chicagoans who are hospitalized with COVID every day, but we also count our capacity across all of our Chicago hospitals. And what I want to highlight here is that although our numbers for hospitalizations remain much lower than they were back at the peak, they are now on the rise. And in fact, you can see, this is again over the summer, we were seeing our cases of people diagnosed with COVID or who have been admitted and who the presumption is they may have COVID and we're waiting on a test result across all Chicago hospitals. We've seen that fall from a peak of over 1,200 back in May to a low of 249 people. But since September 22nd, we're seeing that number rise as well, up by 25%. 313 yesterday when I made this slide, 316 today. That is not the way we want to see increases going with hospitalizations. And so again, if you hear people saying we don't have to worry about COVID because people are not getting seriously ill, they're not getting admitted to the hospital, they're not dying, please don't believe that. We have not yet seen major increases in hospitalizations. We have not yet seen major increases in ICU. We have not yet seen major increases in people on the ventilator or people dying, but that is because those indicators take time to show up. The cases rise first, and then, unfortunately, we start to see these increases. So here's non-ICU. If we're not able to turn things around, I unfortunately fully expect to see even the more serious outcomes following on in the next few weeks. And so to put this all together, let's go back to the same reopening metrics that we have been using since moving out, into phase 3, into phase 4. We follow the same indicators, but they're moving the wrong way. So first of all, we follow the 7-day rolling average: cases, hospitalizations, deaths, and emergency department visits. Right now, we are actually still in the phase where we are in yellow, pause and monitor, because this increase has been so fast. Technically, we're still at not quite 14 days of seeing this increase. Because of the way we count, there can be slight delays in terms of when numbers come in. But with the way the numbers are looking, later this week, we are absolutely going to be in red for cases with a sustained increase more than 14 days. We're seeing some increases in hospitalizations, not yet in deaths or emergency department visits, but regardless, this has me, and it should have you, very concerned. Similarly, in the past week, we moved from green for our positivity rate back into yellow. Pause and monitor. Our hospital system capacity, as I just showed, moved from advanced progress back to continued progress. The only good news was our testing capacity now is over 10,000 tests a day. But we're heading the wrong way. We'll use these same reopening metrics to make decisions about needing to pull back. As the mayor noted, 2 out of 3 Chicagoans diagnosed with COVID-19 tell us that they know the person who likely infected them. People worry a lot about being out and about in crowds, on the CTA, walking down the street. And it is absolutely possible to be infected, but I will tell you, it is not what we see driving infection. Even transit systems around the world have not been shown to be the major sign of spread that we expected they might be. And I think that is because when people are on transit, they're thinking about COVID. They're wearing their mask. They're trying to keep their distance. They're washing their hands because by nature, we worry more about people we do not know. But in fact, where we see the spread of COVID is where we let down our guard, where we literally let down our mask, because we feel comfortable with those we love. But the virus is just looking for opportunities to spread. And Chicagoans also tell us that 3 out of 4 of these close interactions took place at home. And so in that context, right now, please do not invite anyone over to your house or apartment. This is not the time for non-essential gatherings, period. We know that there are essential reasons why people may need to come to your home, for home health care, for child care, for education. But if people are coming into your home who do not live there, you must double down on wearing those masks, even within the home. You must double down on keeping that distance. And if it is not essential, do not invite people to your home right now who do not already live there. Masks. There's been a lot of conversation about masks over the last months and even over the last few weeks. I will be devoting part of my next Facebook Live update to talking about the science around masks. But I want to be very clear that scientists agree that masks work. Nature, which is probably the best regarded scientific journal in the world, published an article this week reviewing the science on masks. And they and I conclude that masks absolutely decrease your chance of spreading COVID to others. That is the main thing that they do, which is why when you wear a mask, you protect your neighbor. When your neighbor wears a mask, they protect you. That is why we need everyone wearing masks. And because people can spread COVID before they develop symptoms, it's why we need you wearing a mask whenever you are leaving your home. It's why we need you wearing a mask if you are even at home with people who do not already live there. And it's why we need you wearing a mask whenever you are within 6 feet of someone who you don't live with. Masks absolutely decrease your chance of spreading COVID to others. There is even emerging data that they may serve some role in helping to protect you from getting COVID. There's some interesting animal models that suggest they may reduce the severity of disease if you do get infected because fewer viral particles can get in. Masks do not harm you. Wearing a cloth face covering does not drop your oxygen level. It does not raise your carbon dioxide level. It cannot give you COVID. It does not make you more likely to get COVID. It should cover both your mouth and your nose. And
Can you say that again?
yes, it should cover both your mouth and your nose. I see a lot of people, and I know you do too, wearing their mask under their chin or just over their mouth and nose. And it is only one strategy. It's one of the most important ones, but you need to wear your mask and also watch your distance and also wash your hands. This is just a still from a study out of the University of New South Wales in Australia that compared a sneeze for someone who is not wearing a mask, for someone who is wearing just a one-layer cloth mask, like a t-shirt, for someone who is wearing a two-layer cloth mask, and for someone who is wearing a surgical mask. When you wear this, you stop germs from leaving your mouth. Not 100% of the time, but it is one of the easiest things you can do to protect those you love and to protect Chicago. And in summary, I want to bring us back to 1918. We've talked a lot about the 1918-1919 big influenza pandemic. It hit Chicago hard, it hit the US hard, and it hit the world hard. First, I would like to remind you that October of 1918 was the month for the surge of influenza in 1918. It was the month where they first made the decision to stop public dancing and public funerals, and then eventually to cancel all non-essential public gatherings. It was the month they published, on the left here, how to make a mask. They called it a germ screen in the Chicago Tribune. We had baseball players wearing masks in public. Folks, we do not have a cure for COVID-19, just as there was no cure for influenza. We do not have a vaccine for COVID-19, just as at that point there was no vaccine for influenza. We do not even have a lot of treatments that make a major difference if people get seriously ill with COVID. And so the fact of the matter is, 100 years later, we're doing a lot of the same things that we had to do then, because this is what is in our arsenal while our scientists continue to work on medicines and on vaccines. So please do your part. We flattened the curve once. We can and will do it again. In 1918 and 19, we saw surges, we saw peaks, we saw valleys, we saw dips. At some level, until we get to a vaccine, we are likely to see that here. We are in the beginning of a second surge here, and now is the time to do the things that we have in our arsenal as well as we can. And with that, I'd like to bring up Dr. Nancy Glick from Mount Sinai Health. She's an infectious disease doctor. And I thought it was important for you to hear directly from some of the healthcare professionals that we are talking to at the Chicago Department of Public Health, hearing their concerns. So please do the things that you know work. Be safe, Chicago.
Thank you, Mayor Lightfoot and Dr. Arwady. So I am, as Dr. Arwady mentioned, Dr. Nancy Glick at the Sinai Health System in infectious diseases. We at Sinai have been seeing what has been described. We are starting to see increased numbers of people with COVID coming into our healthcare system. This translates into more people coming into the emergency department, additional people being hospitalized, and unfortunately, more people requiring both oxygen and ventilatory support. Until about 2 weeks ago, the numbers had been pretty low, and we were really not seeing many cases. 2 weeks ago, things changed. We now have restarted our multidisciplinary COVID round teams every day to make sure that people are being monitored and getting the best treatment possible. We have seen multiple people from the same family, the same household, coming to the hospital ill with COVID-19, requiring hospitalization. This can be devastating to patients and families who may have one member of their family in the intensive care unit, another member of the family on the medical unit but unable to see each other. As a healthcare worker, it is difficult to see this resurge. I think a lot of us in the healthcare system were overwhelmed by the first wave of COVID, and to see it starting up again is really scary. When you see a patient who comes into the hospital initially, who may look pretty good, not require oxygen, and you go back to see them 12 hours later, and then they're requiring oxygen, maybe looking very short of breath, you know that there's someone who could potentially not do well. There are some young people, the majority of people that we're seeing in the hospital are in their 50s, 60s, and as old as 90 years old. We hope that people will take this seriously, that they'll do the things that they need to do to stop the spread, to stop or at least blunt the second wave, and wear their masks, social distance, and avoid crowds. It's going to be hard because it's winter in Chicago coming up, but I think that it's really important so we can prevent the second wave. And with that, I'll turn it back to Mayor Lightfoot.
Thank you. Mary Ann, happy to entertain any questions you have.
Mayor, on the topic that we're talking right now, from John Greenfield from Streets Blog. Epidemiologists have generally advised against indoor dining and drinking at restaurants and bars. But however, in late September, you did relax those indoor capacity rules. And since then, we have seen an increase, particularly in retail-heavy neighborhoods like River North and Lincoln Park. Would you consider restricting indoor dining and drinking again and coming up with another way to help hospitality workers and business owners, such as stipends for keeping businesses closed or grants to facilitate outdoor service?
So there's a lot packed into that question. Let me try to address it, and I'm going to invite Dr. Arwady. I mentioned in my initial comments, I get a report every day from Dr. Arwady and her team, and then we do a deeper dive once a week in looking at the data. And we started to see this uptick. The question I always ask is, what are you seeing in the numbers? Meaning, is there any particular segment, any particular geography, any particular demographic? Because what we want to do is try to be as surgical as possible with targeted interventions. And unfortunately, as I think Dr. Arwady's presentation makes plain, we're not seeing this as a source from one particular area. So going to the question of bars and restaurants, obviously, if we felt like that was the source, we would, that's easy. Easy in the sense of targeted intervention, certainly not easy in terms of the impact on those business owners. But obviously, we're looking at everything. We have to. We're seeing this across the board, as I said, every demographic, every area of the city. It's not going to be easy for us to do a targeted intervention, but we certainly are going to be looking at a range of different options. I don't think there is a cause and effect, and we looked at that. And the question suggests that loosening of restrictions on bars and restaurants occasion and cause this uptick in cases. That is not what we're seeing in the data at all. I think it is what we thought, which is we feared and we're signaling even back in March the potential for a second wave. It's cold, it's flu season, people are going indoors, and so the maximum environment for the virus to thrive, we're now in that season in our city. And again, if we were seeing it in one location or other, that would be, we could address and mitigate against that, but we're just seeing it across the board, as is happening really all across the country and across the world. But we are looking at a number of different tools that are available. But what today is about is a couple of things. One, sounding the alarm, making sure that people understand we are absolutely in the second surge, but also reminding folks of what tools they personally have at their disposal to do what is necessary to try to address and solve this problem. We can't let down, and people have let down. They've relaxed. They're tired of being home. They're tired of, streaming everything that they possibly can on Netflix or Prime Video. They're tired of not being in communion, if you will, with their friends and family, and we all get that. But we've got to go back to what served us well before, which is social distancing, mask wearing, limiting our contact with others as much as we possibly can. And I want to place some emphasis on understanding the challenge of essential workers and essential functions, including education. Dr. Arwady, you want to add to?
Yeah, I would just add a couple things. One is that we actually continue to have stricter restrictions in place here in Chicago than are required at the state level. And I think we've had a very good and robust interaction and engagement with industry partners across the board. That would include the restaurants and bars, where they have by and large done a very good job of following the public health requirements that are in place. As you know, where we have seen spaces where that has not been true, the Business Affairs and Consumer Protection has worked hard to pull that into place. But as the mayor said, where we are seeing spread is not the spaces that we regulate as a city, by and large. And where we make decisions about limiting gatherings, limiting the number of people who can come together. The fact that, for example, in restaurants, we said you can only keep it to 6 people within a restaurant table. Like, that is based on the risk of COVID when people are getting together without masks. And I am always conscious of balancing the economic and the health risks. Of course, as the public health department, I come down first and foremost on doing what needs to be done to help protect the health of the city. But just as we've seen in schools, where the guidelines have broadly been followed, they've not been major sources of spread. Just as we've seen in transit, with a lot of careful attention to the masks and the distancing, we've not seen those major sources of spread. The surgical approach here, unfortunately, is the one where we do not regulate. It is the one encouraging people in their own homes and in their gatherings to really double down.
So Michelle Gallardo is asking from WLS, do you see this current positivity rate, what will it take for the metrics then to cause the city to reimpose?
Yeah, so obviously, big conversation. We're also talking a lot with the state about this. As I think people are aware, in terms of the positivity, the state has set an 8% limit in terms of when restrictions would be imposed. We would not just wait for an 8% limit here in terms of positivity to thinking about what that would look like. The reason I showed the metrics that I showed was to make the point that we continue to follow the same framework that we set out way back in June. The reason we were able to loosen the dimmer switch a little bit was because we had seen 28 days or more of decline, and with that positivity under 5%. That is not where we are now. We've moved into the yellow zone, and I expect really within a few days we will have moved into that red zone in terms of cases. So we will follow all of those metrics. We will be looking to make decisions about what needs to happen in the publicly regulated spaces. But the most important thing is people's behavior in their own homes and with those they love.
So Mayor Glenn Marshall from WGN is asking, what is your response from the 40 elected officials who are concerned about school? If we're so concerned about this second surge, is this really the right time to consider in-person learning?
Well, I always appreciate engagement, and I'd encourage those elected officials to also take advantage of the many, many ways in which we have engaging with their colleagues. We have regular briefings and calls with the state legislature, not just with the leadership, but with individual members. We obviously have a significant amount of engagement with the Chicago City Council. But as Dr. Arwady said, and again, the facts and the data have to be the things that we rely upon. We are not seeing, in looking at the examples of schools that have already been open since September in Chicago, in the same neighborhoods where Chicago Public Schools are, we are not seeing the schools as a source of spread. Archdiocese, charter schools, other private schools, we look at their experience very, very closely. It's not an apples to apples comparison, obviously, but we look at that data very, very closely. And what we're talking about in the announcement that was made on Friday with CPS is this. It takes about a month or plus for CPS to move from being all virtual as we are now to something different. And so what CPS announced on Friday was the start of a re-engagement process with parents, with students, with people in the school community, from building principals and staffs, and of course, teachers. So no definitive decision has been made, but let me also just say this. When you hear people talking about schools, if the first words out of their mouth are not about kids and equity, listen closely to what they're really saying. What the announcement on Friday was about is a simple but important matter of equity. Remote learning works for some. It works quite well. But for some, it doesn't work well, despite all the energy and effort that Dr. Jackson, Dr. McDade, and the whole CPS team have done to bridge the digital divide, to put devices in hands, to make sure that Wi-Fi connectivity is there. Any of us who've had 3, 4, 5-year-olds, having them try to learn through a screen, it's not working. And we're seeing the same issues and challenges in school systems across the country. And the other piece that's missing, particularly for our youngest learners, what do we place a lot of emphasis on when you're young? It's social and emotional learning, as well as your colors, your ABCs, your numbers. So the ability to work in teams, the ability to listen and to follow direction, those very basic rudiments of social emotional learning, you do not get that anywhere close to the way that you get it through in-person learning. For those students that are the so-called cluster students, are special needs and diverse learners, they rely upon the school setting for a number of things, not just the educational learning, but healthcare, about food, about assistance. And we are hearing from a lot of parents of those children about the enormous burden that they're experiencing because of remote learning. So as a matter of equity and looking at who's connected and who is not, who is benefiting from all remote and who is not, we have a responsibility to look at opportunities for those kids to get something different so that they are not left behind. And that's precisely what we're doing. Now, where we will be in November, right? 2 weeks' time, the world has changed dramatically. But we have a responsibility to plan and be prudent in thinking about how we move forward. And again, I'm happy to engage with anyone who actually has a genuine interest in understanding what the dynamics are in our schools, what the dynamics are with our children. I spend time, as I did just this past Friday, going into schools now to talk to the principals, the teachers that are there, the staff, and looking at what they're doing to be prepared, the safety precautions that they're taking. So there's a lot to be learned from that.
On your budget, Mayor,
Yes,
can you confirm that you are considering a $94 million property tax hike and 350 layoffs?
What I will say is this. On Wednesday, we will have a lot to say about the specific ways in which we propose to close the $1.2 billion gap. And I've been very clear since my forecast speech on August 31st that we are looking at a range of different tools because the enormity of this budget gap requires us to look at a number of different options. We always look internally first. We can't go to taxpayers and ask them for more and we pretend that the status quo, turning the size of the budget, the way in which we deliver services, that that's all fine and can't be touched. We've got to look internally first to earn the trust of the taxpayers and demonstrate to them that we are being the fiduciaries that we are obligated to be for their precious, hard-earned tax dollars. And I'll have more to say about it on Wednesday.
And from Greg Pratt from the Chicago Tribune, Cynthia Donald in the Eddie Johnson lawsuit said you, quote, ordered Eddie to dump me by demoting me to a desk job. Is that true?
This is always the case with active litigation. I will not comment on any of the allegations, whether they are true or false.
But Mayor, obviously, you had to be, when you read this and the public read this lawsuit, you have to give us some kind of feeling of what you thought when you read that. How much did you know ahead of this?
I think that as this litigation plays itself out, there will be a lot that is revealed about the allegations. I don't think it's appropriate for me to comment on what specifically I know. I've said this last week because there were a number of, I thought, remarkable comments. Eddie Johnson, obviously, common sense tells you, never told me that he was engaged in any kind of improper relationship with Miss Donald. He never, of course, told me that he was taking her into his office and sexually assaulting her on a regular basis. Why would he tell his boss something that outrageous and beyond the pale? Because if he had said something like that to me, I would have ordered that he be arrested on the spot. Now, again, lawsuits make all sorts of allegations. I know this from 30 plus years of being a litigator, and I think there will be a lot in the coming days that is revealed about the allegations that Ms. Donald has made and the truth or not of them. And I won't say more about this litigation.
Several are asking, though, please describe your participation in Police Superintendent Brown's decision to override the Inspector General's recommendation that a police lieutenant be fired in this case.
I had no role in that.
You did not participate
No,
in
but
that.
I have confidence that Superintendent Brown spent time, as I know he did, in looking at the actual facts and the circumstances regarding that particular lieutenant, and I support the decision that he made, which I think was consistent with the actual facts.
Thank you, Mary Ann. Thank you, Mayor.
I'll give you one more question.
From
It's
Amy-
Monday.
It's Monday. The Census Cowboy. Was it? This is from Amy Jacobson. On July 14th, you said it was not a paid position. Now we have learned that Adam Hollingsworth was paid $5,000 and signed a contract with World Business Chicago. That's a taxpayer-funded organization, and you are the chairman of it.
I don't remember that I said that, but we are way past that point. We're standing here today, Amy, talking about a crisis in our city. And so I think what we should focus on is the immediate challenges that we are facing in the city. So thank you very much. Appreciate it.
Everybody.